I think Auckland's actually regarded very highly internationally in terms of research and its institutions. So we have, I think, 60, 70 fellows coming to ophthalmology in the last 10, 15 years alone from all around the world. There's many from Europe. We've had a number from North America recently, and certainly a lot from the UK. So we attract a lot of interest. I think one of the things I found when I came to New Zealand, obviously I'm from Scotland, and when I came to New Zealand I was initially quite overwhelmed by the very high standard, particularly in relation to our clinical standards, which are very, very high, but also in terms of our research. So we've developed a very large research program over the last 20 years in eye research in Auckland, and that has attracted really the United Nations of researchers.
With respect to healthcare research innovation, in a developed world context, Auckland is up there with the rest of the developed world. We have cutting edge research going on. The National Eye Centre actually is based in Auckland, and that's a hub of research and clinical activities that are recognised worldwide.
This is a relatively unique centre globally because it incorporates ophthalmology, which is basically eye surgery and a lot of eye diseases. It includes optometry, which increasingly has moved from mainly providing visual corrections like spectacles and contact lenses to now doing large parts of eye care. In the New Zealand National Eye Centre we also have bioengineers and molecular biologists and cell biologists. So uniquely we have probably 150 people all doing eye research in one building. And I think a lot of people are surprised by that and admire that, and I think that's something that will actually bring people to this conference to see how we manage to work so collaboratively with other professional groups. The Asia Pacific Academy of Ophthalmology in 2020 is one of the top 2 or 3 conferences in the world. We were very lucky. We had a lot of support professionals in New Zealand who helped us make the bid, who helped us to show the quality of the bid, that we would have the facilities in the new conference centre to actually host a conference of 4,000 or 5,000 people. So I think what we managed to show is we had the professionalism, we had the facilities, and also we had a very high standard of ophthalmology and research that would imbue the scientific programme with a high level of expectation of something new, something novel, something to learn.
In a developing world context, Auckland and New Zealand in general has been actively engaged, in fact punching above its weight in helping the IAPB and helping WHO fight the battle against avoidable visual impairment and against avoidable blindness. So the New Zealand government and New Zealand organisations have been very heavily engaged in blindness and visual impairment prevention activities, not just in the Pacific, although there's a lot of work going on in the Pacific, but in the wider global context, and that is recognised as well. The main program of the IAPB at the moment is called Vision 2020. And it was launched in 1999. It's a joint initiative of the IAPB and WHO, the World Health Organization. And its aspiration was to eliminate avoidable blindness globally by the year 2020. It's a tricky one to do, but as an aspirational target, it's driven and it's allowed people to collaborate, to share advocacy platforms, to share knowledge, and to partner to try and speed up programs that can be effective. And it'll be amazing to see in 2020, and the Auckland Congress will be the opportunity to unveil this, what the preliminary results are, how much impact globally has this program had.